right, so you've been in therapy for a little while, you're feeling better, you're doing better. When is it now time to stop treatment? Hello, welcome to my channel, or welcome back to my channel. My name is Stephanie. I'm Long Island's eating disorder specialist. I post 3 times a week on this channel, and I talk about eating disorders, body image issues, and general mental health. So if any of that interests you, or you want to learn any more about that, please click the subscribe button down below. And I also have an Instagram and a weekly blog that I post every week, and that would be obviously eating disorders are no doubt super complicated, and recovery is not any easier. It's complicated and it's messy. So treatment for eating disorders in particular will look different and very different from other mental health disorders and mood disorders. So this is something that we want to talk about today. You may feel that you've been in therapy for a while and wondering if it's time to stop seeing your therapist. And this is something that could get very, very tricky because what happens in eating disorder recovery is that there's a lot of times that you are facing new challenges as you move along in recovery that a therapist can really and truly help you with and help you overcome that barrier. There are going to be times, and maybe weeks at a time, that you're feeling pretty good and everything's going pretty well, and you may wonder if you still need therapy. So a good rule of thumb, I would say, and I know this sounds super intimidating, but I really would not see a therapist for an eating disorder less than 2 years once you start recovery. So once you start recovery, I would give it at least a 2-year rule, because there's a lot, as I said, a lot of challenges that come up amidst recovery, and it's something really helpful for having an eating disorder therapist on board, because you don't want to get rid of that therapist or terminate sessions and run into an issue or a challenge and not really having it caught early on, because the eating disorder could truly trick you into believing that, you could just slide a little bit here, or, those types of things. And if an eating disorder specialist is not on board, they might not be, well, they would be able to hopefully spot when something is going amiss and your eating disorder may be sneaking up. And what will happen is that potentially, not all the time, but potentially your eating disorder could slip back, especially if you're not receiving therapy, and then all of a sudden you are back in a very bad place. Maybe not at the initial start, but you could backtrack very, very quickly. You can backtrack quickly with your eating disorder, and then you're kind of feeling like you're back at square one, and it's just a whole other slew of issues that come up with your eating disorder, and then you're just really feeling bummed and almost discouraged. If this is something that you are feeling and pondering, definitely have a conversation with your therapist. It's not something to hide out from, and it's not something to shy away from. A good therapist, if they truly believe that termination of therapy is appropriate for you at that time, they're going to say that, and they're not going to just keep you going for no reason. And that's something that, have that conversation. Talk about what you are struggling with, or what you feel like you're doing better with, and why you think that maybe you want to dabble and see what termination of therapy would be like. Obviously, that's the ultimate goal, is for you to get to the point that you no longer need the eating disorder therapist. But I really think that everyone could benefit from a therapist, because the eating disorder therapist, yes, the eating disorder is their specialty, but they could talk about all the other things that come up in life, and life is not perfect. Things happen, and it's always something good to have an eating disorder. It's always something good to have a therapist on board. Regardless, have the conversation with your therapist and truly be open and receptive to what they have to say. If they are saying that they really don't think it's the best option for you right now, hear that, and perhaps just be really honest with yourself, and maybe it really isn't the best option. Of course, no one can make you do anything except for yourself, or if you're under the age of 18, then your parents really do have the final say. I'm sorry, but it is true. So if you're over 18, you have the ultimate say in what you do. So if you feel that you really want to terminate therapy, that's something that I hope that you at least discuss with your therapist and have a termination session, and don't just say, I'm out. Have a session to, close everything up and finalize everything, and that's going to be helpful for you as well. However, what I would suggest is that you don't just go right into terminating therapy. I would suggest dabbling with it. Ask your therapist if perhaps you can start to decrease the frequency of seeing that therapist. Usually it's at least once a week. So if you're seeing them twice a week, maybe go down to once a week. Or if you're seeing them once a week, go down to every other week. And just see an experiment. This is an experimental phase. It's not something that should be permanent. It's just something to experiment with how you're doing if there's longer times in between sessions. And if you truly feel like that's something that you're able to cope with and you're able to get through all those challenges, then proceed to maybe lessening it a little bit more, maybe seeing once a month and going from there. And then if you decide that termination is ultimately the best decision for you at that time, then go ahead and have that discussion and have that termination session with your therapist. Now, what becomes tricky is that, let's say you did terminate therapy and now you're finding that your eating disorder is sneaking back up and you want to go back to therapy and have your treatment again. This is something that happens, and it's not something to be ashamed of, and it's not something to be judgmental of. It happens. What's really important when that happens, or if that happens, is to be forgiving toward yourself and compassionate toward yourself. It's not something, as I said, it's not something to be judgmental of, and it's not something to tear yourself apart over. That's just simply not helpful. It happens. There is absolutely no shame in going back to treatment, and reach out to the therapist that you had. If you found that they were helpful for you, reach back out to him or her and start sessions back up again. I'm sure that they would welcome you with open arms. Most therapists, if not all, at least they should, have an open door policy. I hope that you found this video helpful. If you did, please give it a thumbs up. If you have ever been through this, please leave a comment down below about what your experience was and when you kind of knew that therapy was no longer needed for you. If you'd like to subscribe to my channel, please do so by clicking my face over here. And I wish you openness on your journey to finding your state of balance. I'll see you in my next video.